Hi, thank you for coming. Today, I'd like to go over a series of exercises to strengthen the rotational components of ankles and feet. For the plantar fascia, your Achilles tendon, to help repair sprained ankles, but also to help to prevent ankle and knee injuries and also from balance backwards. But even if you're an athlete, we're going to be doing holding isometric holds of 15 to 30 seconds, so that in life, you're a runner, a sprinter, a walker, you move your feet a lot, or you're very sedentary, you don't use your feet very much and they atrophy. But what they're not good enough in is stabilization in a compromised angle. In general, okay, we'll be just standing at the wall. Now we're doing the sides, okay, the sides of the feet and ankles and all different angles of rotation. So the best is if you can hold on like this, like the side bridge type position at the wall, and we'll just be on one foot. I'm using a rolled up towel. You can use a toe pro, or if you have some other kind of implement that's something like that for feet strengthening. So we'll be just doing side bridge position at the wall. I'm going to move the camera down so that you can have a better view of the angles of the feet and ankles. And many of us, have sprained our ankles in the past. And so there's always like a weak direction. Okay. So yeah, this is just a rolled up towel. I'm going to start working on the left foot. I badly sprained the outside of my left ankle in volleyball a long time ago. So it's just long tissue that's too weak. And so we want to tone it again. So we're going to start left foot on the inside here. So left foot is on the right side of the towel, and I'm in that side bridge position that I mentioned. Right foot up. Now the heel is a little low and the knee is bent. We're going to take the time, and you can join me. I'm going to go through the full series. So I'll do the isometric holds. If you want to speed it up, you can just see the different angles. Now you straighten the leg and lift the heel up a little higher. In each position, we're holding 10 to 15 seconds. You may feel some discomfort if you've injured your leg or have some tendinopathy in the joints. And rest. And by just moving around, doing a lot of reps, you just basically irritate it. So here we want to rather just re-strengthen and tonify tissues. So now this is right foot, left forearm on the wall, the knee is a little bent, and the heel is close to the floor. And then we'll go up a little higher, legs straight. Not locked out knee though, and heel is up higher. Okay, and rest. So we're doing our supination, pronation, eversion, inversion. Now the stretch associated with what we just did is for tibialis posterior. So you would be facing the wall. I'm going to just demonstrate facing the camera first. The back knee is bent and the front leg knee over ankle, but the back knee goes in slightly like that. Ideally, you'll feel it here in the tib post, so you're lengthening and strengthening the tibialis posterior muscle. So the front leg, left leg is back, the knee is a little bent, and the knee angled in. All the toes are on the floor, and always check that the toes are angled forward. You should make sure you're not out-toeing. We want to best even out the tension of the fascia around our ankles and feet here. Okay, and now we'll switch feet. Right leg is back. The knee is bent. Toes are angled forward and the knee slightly angled in. And depending on you, what your injury history is and how you basically walk and move in life, you may feel different places of stretching or tension or pain on the feet. They might be not the same on both sides. but over time with regularity, you can align yourself better. Okay, so we're going now back to second position. So we're again right elbow on the wall, right forearm on the wall, side bridge, but this time we're on the outside. So we're on our left foot is on the left side of the towel. And first position is knee is bent and heel low. And many people who have weak outside of the left foot, if your proprioceptors have died off on the outside of your foot from lack of strengthening, then this might be a bit painful. Okay, lift a little higher now and straighten the leg. If you can't lift or you can't straighten, then that's okay. You just hold whichever position you can currently do. And over time, you can build up to the full range. Okay, and rest. And now the left arm is on the wall, left forearm on the wall. The right foot on the right side of the towel. The knee is a little bent and the heel is low. So I have these silicone toe spacers. I do like to wear them, not all the time, but when I'm weightlifting, I do for forcing you to work the feet more because they keep your toes apart, so you have to use more of the intrinsic muscles in your feet. And then lift a little higher. Heel up higher, knee is straighter. Toes are always pointing forward. Okay, and now the stretch for this position is just straight knee, like this. So this, gastrocs, mostly this is soleus and of course Achilles. So at the wall, you're facing the wall. We'll go left leg back first. Toes are angled forward and the knee is bent, but this time the knee is not angled in. Ideally, these stretches you would hold for 30 seconds to help in the remodeling of the tissues. Okay, now we'll switch. Right leg is back. Back knee is bent. And you just lean into the wall a little, but the heel should stay on the floor. And this angle also will help keep the foot, calcaneus and talus, in their aligned position to get the full rotation of our ankle joints. Okay, rest. And then after doing foot strengthening or footwork, I always like to just do a bit of really slow walking, heel, outside of foot, baby toe to big toe. So it looks like this. With each step, ideally, you go heel, outside of foot, baby toe to big toe, so each toe independently, and then back heel up, toes are bent, heel, outside of foot, all the toes roll through. So you see you get some rotation of the ankle as you go. And when you're walking also, this is a real problem. Flat-footed walking, the back heel should come up and then the heel lifts and the toes bend. And with regularity, if you do this kind of work every day, if you have any pain or neuropathy, I would expect you'll feel a lot better and wake your feet up. Thank you very much and look forward to seeing you next time. Bye-bye.